Hello, my beautiful patients. I am so happy to see you. Well, as I've explained before, I'm Dr. Lucietto, and I have made these videos to kind of help my patients understand what is going on with their bodies when they get a particular diagnosis. I wanted to post them because I do find myself repeating what I'm saying many times, and I wanted to prepare videos that allow patients to hear the whole story. Sometimes we get interrupted, sometimes there's a lot of things going on in the office, and we miss out on some of the details. Now, these videos are not intended to treat anyone. They're only meant as like a supplement to what I provide in the office. If someone who is not my patient wants to watch them and learn from them, you are more than welcome, but this does not replace regular medical care. Want to make that perfectly clear. So one of the things I wanted to talk to you guys about is I've been seeing more and more cases of Lyme disease. I don't know how familiar you guys are regarding Lyme disease, but it is an infection that is made by a bacteria, causes many symptoms, and those symptoms, if they go unnoticed, can allow the disease to progress to worse symptoms. And that's the main reason why we treat. Now, just because you've been bitten by an insect does not mean that you have Lyme disease. Usually it is a deer tick that is the vector, which means the tick doesn't get sick. But when it bites you and injects its saliva into you as it's sucking your blood out, sounds so attractive, doesn't it? You can get infected by the Borrelia burgdorferi. Now, the tick itself has a chemical in its saliva that is very similar chemically to lidocaine. The lidocaine-like substance will numb the area so you won't even feel the tick bite you. And that can be a disadvantage. Now, when you do get infected, you get infected with our little friend who's not so friendly, all right? This is a replica of Borrelia burgdorferi. He's kind of cute, isn't he? Yeah, but I can tell you Lyme disease is not cute. All right. So if we can catch it early and treat you, it's what? 2 weeks of antibiotics and you're done. And if you got a sensitive tummy, a little bit of diarrhea. But you can also counter that by using a probiotic. But we don't want to put too much in one video. It can sometimes be overwhelming. Anyways, the Borrelia burgdorferi in the first stage will produce a target lesion that is what occurs around the bite. Sometimes people don't even notice it. All right. When we mean by a target lesion, it almost looks like a bullseye where the center is red and could be raised. It can be a little indurated, which means it's a little firmer or thicker in the center than it is around in the surrounding tissues. And then there's a clearer area around that center, and then a red area again. Now, it doesn't have to be perfectly round. It doesn't have to be oval. It doesn't have to be square. It doesn't have to be anything, all right? Because it all depends on where the bacteria is sitting and how much of it has decided to be injected and then replicate, because you know they make babies, and this can be a problem because it's their reproduction that sustains the disease. So the whole idea is to take the antibiotic to kill it so that it doesn't cause a problem and it can't make little babies to cause a problem for you. There's also an accompanying condition called erythema migrans that can occur in that first stage of Lyme disease. You can also get a headache. You can have aches and pains in your muscles. You can have these rashes that kind of pop up here and there throughout your body, but you don't have to. Just because it's a symptom doesn't mean you must have it, all right? You can get tired, have that mild headache. You can even have some stiffness. I mean, it's like you just don't feel that great, all right? But you don't get so sick that it's alarming and it causes you to rush off to the doctor, or rush off to urgent care, or go to the ER. Many times when a person has those symptoms, they're not so severe, so they're missed by the patient as well as any clinician who could be evaluating you. So you can be treated at that point, but you have to see someone in order to be evaluated objectively, as well as them evaluate your symptoms, which are your subjective issues, to make the decision and diagnosis as well as treatment. All right. Every clinician is a little different. Sometimes they'll ask you to wait and be kind of prospective in your management, where they're waiting to see what other symptoms may develop, which is fine. And it's your job then to follow up with them in order to keep them in the loop, because the reason why they're asking for that additional information is to help them make a good educated decision for your situation. So that very early case of the disease, if it is not caught, will kind of go into remission. You'll feel better. You'll actually recover. And then it rears its ugly head. And you can have what's called early disseminated Lyme disease. Now, that can involve the heart, that can cause AV block, that can cause neurological symptoms, it can cause numbness and tingling, it can cause facial nerve paralysis, which leads to Bell's palsy, which causes your face to kind of droop. All right? It can be one side or the other. There are many different conditions that can cause Bell's palsy. So just because you get Bell's palsy, don't think it's only because of Lyme's disease. All right. You could have a viral infection. You can have an ear infection. You can have a tooth abscess. But we're talking about Lyme's today. We're not talking about all of those other things. Now, you can also get joint pain, muscle pain that move around your body, but these symptoms are very nonspecific, which is part of the problem. It's not like these symptoms just scream Lyme's. So we put together the likelihood of a person having a condition. These symptoms are nonspecific, they're not pathognomonic. What I mean by pathognomonic is there are some conditions that give you classic presentations that are found only with a specific condition. Now, the bullseye target lesion is associated very closely with Lyme's disease. So that is a very important fact. That is something your clinician really needs to know. It can be eye involvement, where you can get redness of the eye. You can get what we call iritis, which is irritation of the iris. You can also get redness or erythema, or even a little bleed into the sclera, which is the white part of the eye. You can get blurry vision. You can get conjunctivitis, or part of the lid on the inside. That is the conjunctiva. Those can become very red. But Lyme's is not the only condition that can cause that redness. There are a lot of different bacteria that can do that. Viruses as well. And God forbid, amoeba or parasites. We don't want those in the eye. Actually, we don't want those in our body, but that's okay. We can deal with that too. It can affect your kidneys. It can affect your liver. It can affect every organ in your body. But a lot of it depends on what is your bacterial load. The thing that's most concerning once you get to early disseminated disease is that the Lyme's can actually cause a heart block. Now, there's 3 different types of heart block. I'm not telling you this to memorize it. I promise I'm not going to quiz you. But I want you to understand there's first-degree heart block, which is something anybody can live with. It only is a problem under certain conditions. And if we notice that a person has got first-degree heart block, we tend to avoid using certain medications, because there are medications out there that can cause additional issues. Now, there's 2 types of second-degree heart block, which we're not going to get into too much, except that one of those is pretty severe and requires what we call pacing. All right. Pacing is when we put a device, we put a pad like those, the AEDs. We can use those as pacers temporarily, where we'll put a pad on your back and on your chest. And if your heart decides not to beat, it'll kind of give it a little bit of a push to make it beat. It will not cause pain, but it's definitely not the most pleasant experience in the world, but it'll keep you alive. So I think that's a trade-off right there. All right. There are a lot of things that we do in medicine that are not very pleasant, but they keep you alive. So we'll do it temporarily in order to help a person so that we can get them to the stage where we have everybody in place in order to place a pacemaker. Now, everyone is a little different. Just because you get Lyme disease does not mean that you're going to end up with a pacemaker. But there are some individuals, that's actually what causes their condition to be identified, is that they either have episodes of passing out, or they are dizzy and lightheaded. And when they present, this is how I've caught a couple of people recently, and we've had to send them in for a pacemaker. They scare the bejeebies out of me when they insist on going home. My goodness, I had one patient, I told him, I finally got the serious nature of the condition across to him when I told him, you can either call an ambulance, call a relative, get yourself to the emergency room so that we can get a cardiologist involved in this, or I'll just come down and pick you up myself. And he got the message. So he made his way to the ER. He wanted me to call his cardiologist that was out of state, which I did do, because he had another condition years ago that had to be addressed. But we took care of him, and he's doing just fine. But we also treated him because we had to get rid of that Borrelia burgdorferi. Everybody is allowed to live, or, everyone has a right to live, however you want to put it. Whoops, we want to get that amoeba out of the way again. Let's see. Oh, goodness, I have these guys running all over the place. But this little guy is not allowed to rent. Oh, goodness. What is this one? Ebola. Oh, that'll be another time that we talk. Actually, my daughter years ago was just enthralled with Ebola. She wanted to read everything there was about Ebola, because I taught her the best thing you can do is understand the condition. You don't have to want it. You don't have to be infected with it, but there's no reason to fear it, because if you understand it, you can avoid it. Now Lyme's is coming back into play here. Now, in order to help reduce your risk of developing Lyme disease, you want to avoid ticks. One of the things you want to do is don't decide you're going to dance out in your bathing suit underneath a bunch of pine trees, all right? They're everywhere. They sometimes look like little spiders, but they're usually round. They've got a lot of legs, and they got those little pinchers that'll bite you in order to get their little saliva into you. They're not so interested in infecting you. They're just interested in getting your blood. Isn't that interesting? But if you cover up, if you're going to be doing work outside, long sleeves, maybe even put rubber bands around your areas of clothing that so that you don't allow them to crawl up your sleeves. Wear long pants. Wear socks instead of sandals when you're in a high-risk area doing gardening, weeding, that type of thing. Otherwise, when you're outside, when it's hot like this, boy, sometimes you don't even want to wear clothes, but that'll lead to a whole different set of problems. So I am not an advocate of nakedness outside. Inside, you can do what you want inside, because there are times when you don't have air conditioning. That's all you want to do is just lay on the bed and not move a muscle. But anyways, getting back to our Lyme disease, there are a few different antibiotics that we can use to treat. They can be taken for 2 weeks, and maybe you might get a little upset stomach, maybe even a little diarrhea. We can try to avoid that by using a probiotic and having you eat things that as long as you tolerate them, like kefir and yogurt, because that'll help kind of counter what's going on in your gut as a side effect when you're taking the antibiotics. But that's the only treatment, you got to take the antibiotics, and taking them only halfway through the course, got to take them all. No leftovers. That's the kind of situation you don't want to have leftovers. All right. So we talked about erythema migrans. We talked about the target lesion. That's something that we find in the first stage. It's usually a few days to even a month after you have the tick bite. Then there's the disseminated stage that can occur weeks to months afterwards, but it can happen very close to the time that you're bitten. But that is something to be concerned about because there are a lot of different problems. Kidney problems, liver problems, eye problems. It doesn't mean that you have to have these problems. You don't have to have all of them. But the risk factors, the likelihood of infection, exposure, and then the presentation all go into our entire process of making the diagnosis. So months to years after the bite, you can also have the late stage disease. That's when you can really have some problems. So what we're trying to do is avoid that late stage disease. But that's something that we deal with on a case by case basis. The key is that you're the one that knows you've been outside. You're the one that knows you have redness. You're the one that needs to haul yourself into an urgent care, your regular doctor. You need to bring it up. And you can ask point blank, because I have to admit, there are a lot of things that we deal with when we see people at urgent care, a lot of things that we deal with when we're in the office. It's a partnership. And if you're concerned about something, you've had more time to think about it than we have. So if you took the time to take your symptoms and piece it together, well, ask the question. And if whoever is taking care of you believes that it's another problem, they'll explain it to you or ask questions. Remember, your health is way too important to be taken seriously, and you've got to be an advocate for yourself. So hopefully we'll talk again soon, but I did want to get that information on Lyme's disease out there because there has been an increase in the summer of 2026 of cases. I'm not sure why. I don't know if it has to do with the weather or if there is just an increased bacterial load out there or more ticks. But protect yourself because it's not worth having a problem that causes you trouble for years.